I'm Dr. Elona with Inspire Smiles, and today I would like to just give a little overview of what Invisalign is. There are many misconceptions about the treatment, and it's viewed primarily as an aesthetic treatment, although the primary goal of Invisalign is not really aesthetics, it's more of a byproduct. Invisalign is a clear alternative to braces, so it is an orthodontic movement, just like traditional wires and braces would move the teeth in the correct position. Invisalign does exactly that too. Although we don't have to use metal brackets, we don't have to use metal wires, we can do it seamlessly with clear aligners. And Invisalign treatment is, again, designed primarily to expand the arches, which are, it's the bone that holds the teeth. The arch form is meant to be in a certain shape and position to accommodate the teeth to be in the correct locations to, number one, goal of Invisalign and any really orthodontic treatment is to create appropriate airway. So there is enough space in the throat for the air to go in, to get enough oxygen for the body to function at its maximum capacity, to give you a sense of well-being, feeling great, and also oxygenating the body and also just staying healthy and well. So primary goal of any orthodontic movement, as well as Invisalign, is to create ideal airway space. So that's number one. Number two is to create structural integrity to the system, which is teeth is one part of the system, also ligaments and muscles that hold the jaws together, and they connect in this area that's called TMJ joint, assures structural stability and integrity to that system, so the system doesn't break down over time. Number three goal of Invisalign is to create functional stability and long-term sustainability of function of teeth, which is basically chewing. They are there to chew. And when we chew, there is stress that's being applied on the teeth. There are forces that are being applied on the teeth as we chew, and they need to be in certain locations, distributed as evenly as possible among as many teeth as possible, mostly in the back. This is where we chew. We bite with our front teeth, so like this, going forward, like kind of like that, and then chew with our back teeth. So again, where that happens and where the forces are aligned has everything to do with whether or not the teeth wear with time. They don't wear with time just from us getting older. They actually wear due to inappropriate forces being applied on the teeth in the wrong directions. So to assure that teeth don't wear down, any dental work that gets done also lasts, we need to control the forces. So that's the third benefit of Invisalign. Aesthetics would be the fourth and actually the last benefit, although it's not so much the goal, it's more of a natural outflow of all the other three major health components being met. So those are the most important things that we achieve with Invisalign. It's a very easy, seamless process. All we need to do is take a scan, which we use a scanner, so there's no impressions that are being put in your mouth, no gagging. It's very comfortable, under 10-minute scan. Then all we need to do is take a photo. Yes, we do use our phones, but they don't go on social media or anything like that. It's just for Invisalign actually has an app. It's a photo uploader app. We take a few photos. We can immediately show you a simulation of your smile, kind of like that, what you would look like with your teeth in correct alignment. Of course, aesthetically, it is something that's motivating, like we can see ourselves looking better, then we kind of want to do the treatment. So that's what that's for. You can share it with your friends and family. This also allows us to see simulation. I'll share about that in the next video. And outside of that, that's really all that's required. Other than that, I work on the actual treatment and alignment, and in 2 weeks we get aligners, which are basically clear aligners. They look like that. They come off the teeth, almost invisible, and then they go on the teeth and they get switched every week. And usually the approximate length of treatment is anywhere between under 6 months is limited, or 6 to 12 months. So anywhere like around 6 to 12 months is probably average. And Invisalign does work faster than traditional braces, so that's another benefit. Much less invasive in terms of like being able to speak and eat. You can take them out. and then it just makes it for a better experience from start to finish. There's no, again, wires, bonding, anything, much simpler, and the aesthetic outcome is always a plus, and people are very, very happy once they get the results and get their new smile.